and welcome back to the Postpartum Podcast. I am Alejandra, your host for today's episode. On today's episode, I'll be interviewing my very own mom. She is a mother of two to me and my younger sister. She has a PhD in astrophysics, which she got during her postpartum period, and who is a professor of physics currently at our local community college back in San Diego. She also had postpartum depression. So in this episode, we will talk about her experience with postpartum depression, and we'll also talk about what life was like for her as a new mother, the challenges she faced, and the support systems that were or were not available to her at that time. We'll also reflect on the importance of mental health care and access to child care for mothers in postpartum. So with that being said, let's go ahead and introduce our guest. Welcome, Mom, to the Postpartum Podcast. I'll let you introduce yourself to our audience.
Hi, it's a pleasure to be here. I am Lorenza Levy, and I am Alejandra's mom, and also a professor of physics and astronomy.
Cool. So in our podcast, we're breaking down postpartum and what comes with that and how there's ethical barriers to both the women and the children that are affected by this. So can you tell us a little bit about what life was like right after you had me, or
Yeah,
your first child, I should say?
yeah. Life was really tough, and I didn't expect it to be so difficult. I was juggling being in graduate school and having a first child. However, the postpartum depression came out of nowhere as far as I could see, and it was truly debilitating, and it was really difficult time trying to keep on top of my graduate studies and, of course, be a parent and learn how to parent and learn how to keep a little baby alive. And I was really struggling, and it was very difficult.
So you said it came on pretty sudden, but did you start noticing, like, when did you start noticing symptoms? How far out would you estimate around?
I would say probably a couple days after you were born. I could barely keep it together. I just had a really hard time doing the things that I needed to do to keep you alive, basically. And it was just a very difficult time for me. And it came suddenly in the sense that suddenly you were in my hands. And from the moment you were in my hands onward, I was overwhelmed with the duties of taking care of a child, and then with the added postpartum depression that made everything seem almost impossible.
And at the time, did you know what postpartum was, or did it take you a while to recognize it, or for someone else to recognize it?
It actually took me a couple weeks to get help, and it was someone else. It was actually your father who said, "Hey, this isn't normal. This is not, you're outside of the range of what is normal for a new parent struggling, and you're outside of the range of what, a new parent should be struggling with." And no, I didn't see it as postpartum depression. I didn't realize that I had depression yet. I just thought I was not a very good parent. I just thought I didn't have the thing that other parents did that made it come naturally. And I just thought, oh, this is really, really hard. And I wasn't expecting that. So it wasn't until a couple weeks after you were born that someone said, "Hey, this isn't normal. You should go talk to someone." And that's when I got the diagnoses.
Nice. Okay. So when you were going through the postpartum depression, what kind of support did you have from family, friends, providers, if any? And which was the most helpful to you?
I was so lucky to have such a great community around me, both in my family and in my medical community. I was at a research university getting my graduate work done, and with that came top-notch health providers that I could tap into. And I was so fortunate to get a whole team of people to be able to help me from psychology through psychiatry, through medical, through taking care of you as a little baby. So I'm very grateful for that. I also had the amazing support. Your dad was an incredible father, and he really took up a lot of the baby care duties so that I could focus on me. And yeah, I just had a really good community. And even with all of that support, it was so incredibly difficult that I can only imagine what kind of barriers are there for people that don't have that support.
Yeah, so on that, did you think that having that reliable childcare affected your ability to recover and take care of your mental health more?
Yes, absolutely. I needed, it wasn't a want, it was a need. I needed someone to help me take care of you. That was a full-time job so that I could do what I needed to take care of me, which turned out to be a full-time job as well. And so without like your dad being able to step in and take care of you, your grandmother stepping in and taking care of you, I can't imagine how I would have gotten through that without that. It helped
Now,
me, it helped me
yeah,
recover faster.
yeah. So how would you, I know you said you had a lot of support, but were there any things that, like any support systems, whether medical care, like medical fields, or personally, like that you think would have made things easier for you during that time? Or do you think
Yeah.
that the way that it was approached was good?
Well, I think I was very lucky in being in a time and a place where I could get quick and free access to mental health. That has not been the case in my life since that moment in time. Moving forward in my life, getting the mental health consistently that I need is neither free nor easily available, readily available. So I have struggled throughout my life for finding affordable mental health that is usually not covered by health insurance, that is very difficult to come across, and that becomes stigmatized. A lot of people don't want that on the record. Now it's stigmatized. Now I have a pre-existing condition. And so all of that snowballs into barrier after barrier after barrier for people to get mental help, mental health
So,
help.
yeah, so you talked about the stigma and the pressure. So because of that, do you feel that kind of same stigma and pressure around talking about postpartum depression?
I feel like I have almost a duty to talk about postpartum depression to try to mitigate that stigma um, that I felt I faced. And it's interesting because I felt I faced it until I started talking about it. And then I realized that I wasn't really facing stigma. What I was facing was a lot of people who felt like me, who were unable to speak of it and have a community. So yeah, there's absolutely I feel like I need to be more outspoken about my mental health to help others realize that there's more of us out there and that it shouldn't be stigmatic.
But did it take you a long time to get to that? Like when you were going through it at the time, did you feel that stigma about talking about it? And now that you've grown in your life, you've probably had that revelation, right?
Yeah, it took me a while to get to that point. I think at first I just felt like I was less than. Like I wasn't a, I was less than human. I wasn't meeting the needs of what humans meet. And so I felt like, oh, I can't even do basic human needs. I definitely felt less than. And one of the reasons I think why it took me so long to get help is because it wasn't talked about when I grew up. And so I didn't recognize it as mental health help. I didn't recognize it.
And when you like got the diagnosis from a doctor, whatever, did you feel comfortable when they gave it to you? Like, did they approach it in a way that was like, we're here to help, or did they approach it in a way like, this is just what you have, like you're a mother? Like, did they provide much help as a mother? Like, I feel like women, mothers, a lot of time are ignored and the focus is on the baby's health. Do you feel like that was true to you, or do you feel like that you had a good healthcare
I feel
team?
in that moment, again, just because of where I was, in location and in time, I was at a research university. I had access to really good healthcare. And so in that moment, my mental health provider was extremely helpful and useful and really focused on me. And I felt seen and I felt heard by that mental health provider. But I will say that was the anomaly. Since then, since I've moved away from being a student at a research university, I no longer have that direct access anymore. Um, so yeah.
So you feel like as you've seen like growing and stuff like that, that there's a lot of mental health barriers and stigmas, especially around mothers and postpartum. Now you had a good experience, I mean, quote unquote, good for this with your providers, but what do you feel like looking back at how you felt that maybe healthcare providers could do better to more cater to the mothers and make sure that they're good too, and not just the
Yeah,
child?
I think a lot of the prenatal care that we undergo is about the child and about keeping the child healthy. And a lot of the labor courses that you undergo and the becoming a mother courses that you undergo and things that you learn are all baby centered, as they should be. And but I think that an equal amount of time should go into the health of the mother all the way throughout. There's so many changes happening in our hormones, in our body, in our daily lives, that I think that that should be equally addressed with the health of the baby. Because I felt when I was in the depths of depression, I couldn't take care of you. I simply was unable to care for myself and much less for a baby. So it you if you can't help others if you can't help yourself. And so I believe that a lot of the care should focus on helping the mother. And in a bigger picture, a much bigger picture, mental health needs so much reform. It's so hard to come by. It is so expensive. There's so many barriers to it. I have been fortunate in being able to find it, but it's never been easy and never been cheap. I pay a lot of money for mental health.
So building on the fact that you believed that you were not a good and a fit mother, which I think, I mean, you raised me pretty good. I think you did a good job. But obviously, when I was an infant, I couldn't remember, but I would assume like that was your own thoughts. But do you think that also building on those stigmas, that maybe that was societal, people thinking that postpartum depression means you're not a good mother? Like, you know what
Yeah.
I'm saying?
Yeah.
So do you think a lot of that came from societal stigmas about postpartum depression, mental health making you a bad mother?
Yeah, it took me a while to reach out to my colleagues at the time to kind of let them know that I had postpartum depression. When I was first diagnosed, it kind of shocked me. I was like, depression? The anxiety part made sense to me. The depression didn't. So it was a little bit of a shock, and there was definitely like, oh, I need to hide that. I can't let people know because then all that stigma comes back. So, what was your question?
So did you think a lot of that burden you put on yourself about being a bad mother, whatever, came from the
Not be.
stigmas that society puts on women, and on top of that, stigmas of postpartum depression specifically,
Yeah.
and how that plays into part with women and
Yeah.
mental health?
Yeah, definitely. I think women have a role these days that is that of superwoman. It is virtually impossible to meet the societal demands that are put on women. We are expected to work as if we don't have families and raise families as if we don't work, and that's just not a reality. And I think in that moment in my life, all of that came crushing down. I suddenly realized that not only did I have to be in graduate school and raise a family and take care of myself, like all of that just came crumbling down. And I felt like I was failing everybody along the way. I was failing my colleagues, I was failing my advisor, I was failing you, I was failing my husband. I felt maybe because of the way society has pinned this as motherhood as this perfection and this lovingness and this immediate bond with your baby. And the truth is I didn't have an immediate bond. It took a while because I was struggling, and that was really hard to come to terms with. And I felt like society was going to stigmatize me for, oh, you have that postpartum depression and you don't love your baby. It wasn't that. It was a lot more than that. And yes, it was really hard for me to raise you as a baby. And I think I figured it out along the way. And I agree. I think you were raised to be a lovely young woman.
Well, thank you. So we talked a lot about giving birth to me, but I have a younger sister who you had 2 years after you had me. So in that time when you were going through postpartum depression after you had me, did you think about having more children, or how did you feel that maybe people also like questioned if you should have another child because of your depression? Like, how did you go about that?
Yeah, I think for a while we were a strict one child family. Like, hey, we're not doing that again. And then as I got better and I got my footing and I got more stable and you grew and you went from baby into toddler, things got better and things got more manageable. And we thought, hey, we always wanted two. Two was always our goal from when we were dating to, we always said we want two children. So that conversation kind of came back up again. And I don't think there was ever a, oh, you shouldn't do it again from anyone. It was more of, hey, now we know coming into it that you're likely going to undergo another bout of postpartum depression. However, we can be preemptive and we can look at it kind of going in knowing that this is going to happen and start taking some preventative measures. So while I also got a diagnosis when your sister was born, it was much less. I absolutely was more functioning and I was able to handle it a lot more because we preemptively treated it.
So we talked a lot about society, but do you think that they do enough to support mothers during
No,
postpartum? Exactly.
no.
Depression. But
Absolutely.
to us, this might be obvious, but to a lot of people, they're unaware of the effects of postpartum depression, especially if there's other mothers listening to this podcast or men listening to this
I was
podcast,
going to
maybe
say,
wanting to
let's
support.
expand this out to parents in general,
Yeah, all parents, because obviously you
caregivers.
said my dad took a lot of care, like helped with a lot of that. So this is on both parents, but obviously it's the mothers struggling with it. So
Yeah.
how do you think society could do more, or do you think they do enough?
No, I do not think
Obviously that,
society does enough. I think
yes.
society needs to do a lot more
Hmm.
for new parents and for new families. And that's not just support to the mother, that's support to the whole family because the whole family, I'll use the word struggles, but the whole family struggles when a baby comes into the picture. Everybody has new jobs, nobody is sleeping, there's a lot of work to do. And like I say, we're expected to, oh, take 6 weeks off and get back to work like nothing. That's a really harsh take. Um, Fathers don't even really get any paid leave. And so if we really want to support mothers through postpartum depression, we also have to support their partners and the entire family. And we need to implement family leave for families going through new partner or new babies, like a lot of countries do. For example, 1 year of family leave, and the mother and the father can split that up as they want. They can do 6 months each, or something like that. And so that's I think a lot of what we need to do, and we need to have open conversations about mental health.
Yeah, so in your opinion, should affordable healthcare, childcare be considered part of that help and part of the healthcare, like part of that healthcare you're given to support the mothers?
Absolutely. I think one of the reasons I didn't actually talk about this, but it's coming up now. One of the reasons I struggled so much with a brand new baby is there was no childcare for me. I couldn't afford any childcare. I was in graduate school. We were barely making ends meet. There was no money for childcare. So between your father and I, we were taking care of you 24 hours a day, 7 days a week, while he was working, while I was in graduate school. Just having childcare, I think, would have made a huge difference in how all of that played out. So yes, having accessible, free childcare, accessible, free mental health care is needed, is needed.
So do you think that financial or logistical barriers that are put on women in the society, especially mothers going through postpartum depression, made it harder for you to get both the child care and the personal care that you needed?
Yes. Yes. If I would have had access to childcare, I would have had plenty of time to focus on me and accelerate my getting better. There was no childcare available. There was no funds for childcare. So that delayed my process of getting better because I had to care for you. And yes, your father cared for you also, but
Yeah.
it just, babies are a lot of work.
Yes, yeah.
Um, so yeah, I think that financial barriers were there for me in a kind of more minimal manner. And I can imagine now if you have to work on top of all of that, it just, yes, there's too many barriers.
So I know we've kind of talked about this a lot and you've kind of indirectly said it, but what changes specifically do you think would help mothers today who are going through similar experiences, whether it be your personal experience or like what you think you should have done? Just what changes do you think?
Yeah, so I think through pregnancy, there's a lot of prenatal care. Let's bundle that with mother with parent care as well. What to expect with your body, what to expect with your hormonal changes, what to expect. What does it feel like to not sleep for 3 months? You're about to find out. That would be great if someone would talk to you about how how like that can shake you up quite a bit and like really shake up your foundation. So a lot of talk about the changes and the things that parents will experience when the baby comes. I think institutionalized, implemented policy about parental leave once a new baby comes into the family, and that could be through adoption or through any other method. Anytime there's a new member in the family, there needs to be policy about family leave. There needs to be accessible childcare, accessible mental health care available to all, and obviously accessible healthcare available to our, which I think, healthcare, we're getting there, but I think mental health care and childcare, we're far from, I think, where we should be as a as a society.
And do you think that is because in part women's healthcare is very far behind in
Yes.
comparison to that of their male counterpart?
Yes, I think in part it's because misogyny exists in the sense that, still to this day, most medical studies are done on men and not women. We still understand how men react to illnesses way before we understand how women react to illnesses. And so you can carry that all the way through to prenatal care and pregnancy and postnatal care. Is going to be much less studied than men's health care. And then, of course, comes that idea of women as these perfect mothers, and motherhood as being this all like lovely, divine, which I mean, for the most part it is, but there's some gunk in there too that we should talk about. And then, yeah, and family care and childcare accessible to all. Those are things that I think we should implement. Most advanced nations on this planet do implement those things and have much higher quality of life than we do. So, yeah, we should do that.
Yeah,
We
I
should.
agree. I agree. I agree. So you are a woman of color, and in the whole consensus of healthcare and women's healthcare, but with childcare, do you think that women of color, um, either you or that you've seen or known have experienced then or now, are disproportionately affected by these societal and medical barriers?
Yeah, 100%. 100%. We already know the data shows it that women of color uh, have more complications, have more deaths due to pregnancies than women of not color. We know this. The data is there. Um, yeah, that's just a fact. That's just a fact.
But speak more on the fact of like not just like the medical, but the after. of like women of color getting mental health help and women of color getting that accessible and affordable childcare.
Yeah,
Like, does that play more of a part is what I'm
I think so.
more trying to see.
Yeah, I think so. I mean, a lot of times we ask for childcare and that's seen as a weakness. It's seen as like, oh, you can't raise your children. You throw a racial bias in there and that definitely gets amplified. Um, Say like now I'm a single parent. As when you girls were like in middle school, I was a single parent. There's a ton of stigma to being a single parent, as if it was choices that I made along the way, bad choices that I've made along the way, and then throw some racial biases in there, some racial prejudices in there, and yeah, it there's just more and more barriers, more and more systematic barriers socially, culturally, financially, all of the above.
So what do you wish people understood more about postpartum depression and the realities of motherhood? And more specifically, like that would tie into like the one thing that you think if people knew more, like less pressure, less societal pressure, more help would come from that.
Honestly, I think a huge part is if someone would have sat me down and told me this was the hardest thing I was ever going to do, that it is not easy, that the baby does not sleep all day. Whoever said that, that was a big lie. They cry all day, they want to eat all day. I think if we have had more realistic conversations growing up about what parenthood is, about motherhood, again, we have, at least in my society growing up, this idea of like this perfect motherhood, angelic almost, perfection, divine motherhood, and we don't talk enough about how difficult it is and the frustrations and the anxiety and the parts where you're just like, I don't like this because you don't like everything about parenting. You don't like everything about anything. So there are parts of parenting, and especially with little tiny babies, it's so incredibly hard and it's not fun. And I think I felt like something was wrong with me because it wasn't fun, because I wasn't feeling that divine motherhood. And so I think we could have more honest conversations about what early parenting is and how difficult that postpartum era is, and how incredibly common postpartum depression is. Let's talk about how common it is.
So I kind of want to pivot towards more ethical issues. So I kind of want to know, firstly, from an ethical standpoint, why do you think that postpartum depression or depression in general is valued less than physical health?
I think a big part of it truly has to do with the fact that it affects women primarily, and women's needs, both physical and mental, and women's healthcare tends to be secondary to the male counterpart.
Mhm.
I think that's a big part for postpartum depression. Um, and I think just doctors aren't necessarily trained in, like, medical doctors aren't trained in the mental health aspect of it, maybe because it's thought of as less important or less than. I'm not sure.
And from that perspective, do you think that maybe the system thinks about the efficacy of what their system is? Because I think that would play a big part, especially in women's health and women's mental health. What ethical standpoints do you think they should maybe consider or implement to maybe better cater to the patient rather than the system?
Yeah, I think the problem is there is no thought about it. It comes in as an afterthought, as an, it's not something that's thought through in the foreground. And I truly do believe it's because it mostly affects women. Um, I think that putting mental health, especially postpartum depression, in the front and center of training for OB-GYNs, future, OB-GYNs who will be dealing with the parents that are undergoing depression, should be just as important as the physical checkups that
Hmm.
the parent will undergo during that time. And so maybe bringing the conversation more to the forefront as just destigmatizing it and making it just something that we know people suffer with. So let's check for it and let's be proactive rather than reacting, after the fact.
Hmm. And I know earlier in this conversation, we talked about your leave and working, or just going to school and working, I should say, on your PhD and just in general being a new mother. So, in your opinion, do you think that workplaces or schools or wherever you're putting your time into, whether it be full-time student or full-time job or whatever, do you think that they have an ethical obligation to provide support, whether it be leave or flexibility for mothers experiencing postpartum, but especially mothers experiencing postpartum depression?
Yeah, I do think so. I think there's an ethical obligation on behalf of all of society, and particularly from this frame of reference, yes, from the employers. A leave of absence for welcoming a baby into a family should be something that is implemented, institutionalized, and
Yeah.
not stigmatized, and should
Hmm.
be part of the routine and regular care, alongside with all the medical care. And even if our politicians might not produce policy that does that, speaking from an ethical point of view, absolutely there's an obligation, on everyone to take care of society and take care of these vulnerable populations.
So we talked a lot about kind of institutions, but who do you think does have essentially the biggest ethical responsibility in this? Do you think it is the healthcare system? Do you think maybe it is your support system? Do you think it's even maybe the government? Or do you think it should be spread out evenly? Or do you think one should have more than the other?
I think it should be spread out evenly eventually. But in order, I think, for us to get there as a society, I think it has to be a top-down model. And what I mean by that is I think
Mm-hmm.
it needs to be implemented in policy
Mm-hmm.
so that it is then embraced as a normal, as a part of the regular recovery, as a part of the regular healthcare. And I believe that until we really implement it in terms of policy, I just don't see it happening. I don't see corporations, and I'm not saying medical, hospitals are corporations, I don't know, but I don't see corporations as, wanting to put forth an ethical, viewpoint over the financial bottom line. And I think that's a failure.
Yeah, I agree. And, we're talking a lot about ethics, and maybe for the viewer to kind of specify a little bit, I kind of want to specify we're talking a lot about autonomy. And for the viewers that may not know, that's a part of ethics where it's essentially a person's availability to make their own choice, someone's autonomy. And I think that when it comes to mental health, especially women's mental health, a lot of autonomy for these women is lacked. I think that because of the stigmas on mental health, both societal and maybe just in general, women are seen as maybe fragile, or maybe they can't make their own decisions, or just mental health in general, even men, they cannot be seen to make their own decisions, is the stigma around mental health, especially depression as a new mother as well. So how do you think that maybe autonomy can be changed as a viewpoint for people with mental health, especially maybe in your experience, how you felt that maybe your autonomy was violated, or maybe they heard maybe your autonomy was justified, but how do you think that the healthcare system can maybe improve in that?
Yeah, I think autonomy also comes from knowing what your choices are. And
Mm-hmm.
for example, in my experience, I didn't know there was a choice to be made. It just was never put in front of me that maybe what I was feeling was not, quote unquote normal, or whatever that means. I would have loved for my medical doctor, when they were checking up on me after postpartum, to run by these, like, hey, if you start feeling this, or this, these are your options. This is what happens. This is where you can call for help. Because they did that for my body, and they did that for my babies and my babies' bodies, but no one was doing that for my brain. And so I think autonomy has to come from a place of knowledge and knowing what choices you have, and even knowing that you have a problem. Let's begin there, because a lot of the times we just don't even know how deep in the depression we are. We can't see on the outside. And so we might not even realize that we're in depression. And so it's almost impossible to make a choice when you just don't have any of the information or any of the knowledge that gives you that power. So back to conversations that need to be had openly, not just amongst society, but amongst caretakers and patients. And check marks and checkpoints, just like we check, is a baby developing well, and is my body recovering well? How about checkpoints for, and how are we recovering mentally, and how are we recovering emotionally? Because that's equally as important. And then I believe in that case, then the woman has the power to make choices based on her body and her mood.
Yeah, totally. So you kind of touched on a very central point of ethics and specifically autonomy, which is informed consent, which is essentially what you were talking about, which to maybe the audience that would like to know, informed consent is essentially your ability to make a choice with all the options and knowledge available. So this is a very central idea in ethics because it is often violated, especially for women, people of color, just minorities. Often informed consent and communication from the healthcare professionals to the patient is very gray area. It's very sometimes things don't communicate correctly, whether the doctor is well intentioned or not. Sometimes medical jargon can flow past people's heads and they don't know what options they have. So I think a big point of healthcare ethics is this informed consent and how doctors kind of communicate to their patients. And so I think in your case that lacked a lot. So you're talking about these conversations. Can you speak a little bit about maybe what the main point of topic of a conversation you would have to kind of promote this informed consent to maybe promote better or more broad options for women?
Yeah, I truly was so blindsided by the postpartum depression. It was so not spoken about in any part of pregnancy, the pregnancy courses, the labor courses. Not a single time is postpartum depression really even talked about. And so you're relying on a person who is already feeling very, very low to be proactive in seeking out help and be proactive in basically chasing down the help and the medication and trying one and trying the other and kind of sticking with it until you find the right choice. And I would have loved to have had an earlier conversation, much earlier, early in pregnancy, all throughout pregnancy. Every time I went in to check in with an OB-GYN to talk about mental health and talk about options for care and options for therapy and talk therapy and medication and all the things that are available to one. And I still feel like I never was presented with all my options. I feel like it
Yeah.
was well, let's get this taken care of. Let me write you something to kind of help you, and then go over there, go talk to the psychiatrist, go over there, right? Send the problem elsewhere, and they'll
Mm-hmm.
take care of it. And there was never really a, there's all these things that you could do. It was just like, here, start with this, start taking this, go over there. Um, so yeah, I still don't even know what all my options are or were at the time.
Yeah. So with that, do you believe that kind of healthcare systems or maybe even the educational systems have an ethical duty to educate mothers or just people in general? Because even if you're a partner, a future partner, or maybe you just have a friend that's going through this, that they have an ethical duty to educate people about postpartum depression and maybe mental health in general before maybe they give birth or just because you're a woman.
Yeah, I think everyone has that obligation to talk about it and to make it available. Because again, or else you are once again putting the burden on the person who is suffering to go find the help and put in the effort to get the help. And that
Hmm.
when you're in the depths of depression, that's an impossible task. That's an impossible task. So you need your community around you equally as invested in your mental health. So yeah, those are conversations that need to happen. Look, just like we bring the partners along for all the pregnancy classes, and you bring the partners along for the labor classes, and the partners have to go through with the breathing and the exercises. Okay, let's also do that with the whole family along, with the whole support system in mental health, particularly postpartum depression.
So, earlier we also kind of talked about the pressure societally that women face and how and the kind of stereotypes on mothers and working mothers and women in general. So how do you think those cultural or societal expectations about motherhood and women create ethical pressures on women to hide struggles like postpartum depression, or maybe not even know that they have it and think it's normal?
Yeah, so I'm going to come back to policy because our society is a very capitalistic, money-driven society, work, work, work.
Mm-hmm.
And a women's role in the society is meant to be work like you don't have children and raise your children like you don't work. We're expected to be perfect in both of those realms. And I mean, obviously, we know that that's not possible. And I believe that the woman's role as a mother and as a working parent is not going to change in this society until we implement policy that will then change the structure of our society. And I'm sure look at countries where they have these strong social programs in play where they might give 6 months of leave to both parents to figure out how they want to deal with the postpartum. That is integrating all of society into changing the narrative about the perfection of women, the perceived perception of, you're supposed to be a perfect parent, and the perceived perception that motherhood, more than parenthood, motherhood is this like almost like this angelic topic, and everything is beautiful and perfect and a mother's love, and that's not true. That's not true at all. And so when you have a mother that is struggling with postpartum, now you're not just struggling with postpartum, but you're also struggling with how society is going to perceive you because maybe you haven't bonded with the baby as quickly as you
Mm-hmm.
thought you would. And maybe you are struggling to do basic tasks like breastfeed, and you feel like now you're also a failure in terms of that societal view on you. And then you're not at work, so you feel like a failure at work, or you are at work and you're not with children, and you feel with like your failure at children. And like we just can't do it all. And as a society, we need to stop expecting women and mothers to do it all and really step up and level the playing field by leveling the conversation and the responsibility.
Yeah, and with that policy that you said implementing will kind of change the whole sphere that we look at mental health and women's mental health. Do you think that with that, it is ethically fair that often access to mental health care or child care often depends on income or insurance status?
That is so incredibly difficult. That is one of the most inequitable pieces of our society is childcare and access to particularly mental health. Um, Finding mental health is still really difficult. A lot of insurance simply won't take it, won't apply it, or if they do, it's a 5 month waiting list to see someone. It is incredibly inequitable as it is. And
Hmm.
so we have a responsibility to make it more equitable. It should be as easy as taking your child to the doctor when they have the flu. It should be as
Hmm.
easy as scheduling that type of an appointment. And it never has been. And I hope that one day it is.
So I want you to say one thing to each four of these things. I can repeat them for you if you want. um, about maybe advice or what you would like to see from these people. So number one would be a mother right now with a newborn child who has postpartum depression. Number two would be the father of that child. Number three would be the healthcare field. And number four would be society as a whole.
So to that mother, I would say, um, it's okay. Nobody knows how to do it. Because honestly, I do feel like there was a lot of, oh shoot, I don't know these things and I probably should. No, we don't know. and I think to let a new parent know, we don't know these things. This too shall pass. This too shall pass. It will get better, and ask for help. That's what I would tell a new mother. Ask for help. What I would tell a new father or a partner would be to support your partner as much as possible, because most of the taxing physicality is going to be the mother's. And so for the partner to support that person as much as possible, but also take care of yourself. For the healthcare providers, I would say, let's talk more about prenatal or postnatal. Let's talk more about the mother. Let's talk more about how difficult breastfeeding is. It's not as simple as one would think, and it just happens naturally. No, let's talk about how difficult it is. Let's get more training on all of that. And let's get more training on recognizing postpartum depression as a medical provider and being able to refer patients to mental health. And for society, I would say, let's not expect mothers to work as if they don't have families and raise families as if they don't work. Everybody's got to pitch in. Let's all do it together.
Well, thank you very much. I really appreciate you giving your insight into this podcast. It's very deeply appreciated. Um, you're a very strong woman. You're a very strong mother, and I appreciate you being able to talk out about it and breaking these stigmas and these barriers. So thank you for joining our podcast. Would you like to say any closing thoughts, any closing ideas?
No, thank you for having me, and thank you for having this conversation. It's an important conversation to have. You're awesome.
Thank you.
To wrap up today's episode, my mom's experience shows that postpartum depression is not just a personal struggle, it's also an ethical issue that reflects how society supports or fails to support mothers. We talked about the challenges she faced balancing mental health, education, and motherhood, and how limited access to childcare and mental health resources made that even harder. Her story highlights important ethical issues about fairness, responsibility, and access to care. Should a mother's ability to get help really depend on her financial situation? Do healthcare systems and workplaces have a responsibility to provide better support? And how can we reduce the stigma that prevents so many women from speaking out? Overall, this conversation reminds us that supporting mothers is not just a private matter, it's a shared responsibility. Improving access to mental health care, affordable childcare, and education about postpartum depression are not just helpful changes, but ethical ones. Thank you for listening to this episode of the Postpartum Podcast. Once again, I'm your host, Alejandra, and I hope that this conversation helps bring more awareness, understanding, and change for mothers everywhere. Tune in next time for another conversation about socioeconomical disparities in women's postpartum healthcare. Thank you for listening.